Hello, my name is Cassandra Romas and welcome to 30 Medical Minutes. Today we will discuss pain management. When patients have acute or chronic problems or face the end of life, pain can become a primary and overwhelming concern to them, their family, and healthcare providers. Our guests today are Karen Kiefer, RN and Legislative Chair for the American Society of Pain Management Nursing, and Fran Ho, PhD, a palliative care and pain management consultant. They are both affiliated with Overlook Hospital in Summit, New Jersey. Karen and Fran will discuss pain management and describe how pain can be alleviated or managed with proper medical attention. Early intervention has been found to reduce health care costs, limit disability, and dramatically improving the lives of patients. We will learn that patients share responsibility with their healthcare providers to assure effective pain care. And these responsibilities will be listed and explained to you. We will also discuss the problems that must be dealt with the storage and disposal of pain medications. I hope that you will join us as we explore responsibilities and pain management. And now let us welcome Karen Kiefer and Fran Ho to 30 Medical Minutes. Welcome, ladies. Thank you so much for joining us today on 30 Medical Minutes. It's a pleasure to have you.
It is wonderful to be here, and I am so excited to discuss this important issue that every person in the United States experiences, pain. At one time or another, everyone is in pain.
Okay, fine. Well, let's start off by learning a little bit about the two of you. Karen, tell us a little bit about your background.
I have been a nurse at Overlook Hospital for almost 30 years. I work currently in the interventional radiology suite, which is involved in both acute and chronic pain. I'm also on the stroke team, and I'm also on the cardiac CT imaging center. I am also a member of the American Pain Foundation Action Network of New Jersey, which provides resources to people who experience pain. I work as a legislative chair for the Garden State chapter of the American Society for Pain Management Nursing, whereby I look at different legislative issues so people can feel empowered and get involved within the scope of a legislative side. I'm also a person experiencing chronic pain.
Oh, wow. Wow, well, first of all, what a resume, and congratulations for everything that you do. And obviously, there's no lack of people who experience pain. And now let's find out about Fran. What about your background?
Hi, I'm Dr. Fran Ho, and I'm the inpatient pain coordinator at Overlook. I also have my own practice called Always Think Comfort, where I provide pain and palliative care consultations for patients in long-term care and assisted living facilities. I've been a nurse for 30 years. My initial training was at Holy Name Hospital School of Nursing in Teaneck. I got my bachelor's degree at Felician College in Lodi. I have my master's in nursing from Hunter College in New York City. And I got my PhD in health administration from Kennedy Western University. I am nationally certified as an advanced practice nurse in hospice and palliative care, and I'm also nationally certified in pain management. And with Karen, I'm a member of Garden State Chapter ASPMN, the American Society of Pain Management Nurses, and I am the chairperson for programs.
Wow, you ladies are more than qualified to talk about this, and I really appreciate your being here. So our topic today is pain management, which is a rather unique topic. I would think that a lot of our audience will be saying pain management. and responsibilities for pain management. It's going to be interesting to learn what we mean by responsibilities, but first, Karen, start us off by talking about pain and what it means to you and what it means to all the people in the United States and around the world.
Pain is truly a public health care issue. Over 76.5 million people experience pain lasting longer than 24 hours. That is approximately 26% of our national population. It's really important that we think of it not as a separate entity, but as a broad spectrum view of every disease process or every traumatic event.
Mm-hmm.
When you think about patients that are in the hospital, probably 35 to 50% of the patients that are in the hospital have a diagnosis of pain, along with whatever other diagnoses that they have.
Mm-hmm. Well, people don't think of it as a diagnosis of pain. They usually think of pain as the obvious result of whatever illness or ailment that they have, and so therefore it's hard for us to think that it's being diagnosed, but that's your whole point, isn't it?
Right. Well, when you think about older people that have arthritis, the main symptom of arthritis is pain. Mm-hmm. When you think about all the people that go for surgery, the main problem they have post-operatively is pain. When you think about people with fibromyalgia or even cardiac conditions that have chest pain, or even lung conditions where it's difficult for them to move around and they have pain with movement, which makes them short of breath. So there's really a lot of other diseases that people have that have pain as one of the symptoms.
Mm-hmm. Well, if people have pain, and you're saying that pain management is an important component here, are you saying that patients have not only a desire to have pain relief, but that they have the right to ask for pain relief?
Absolutely. I mean, we at Overlook Hospital, we strive really hard to make sure that patients' pain is controlled, and patients have a right to adequate management of pain. Joint Commission, which is the agency that accreditates hospitals, has one of their standards that says patients have the right to adequate assessment and management of pain. And when they come into accredited hospitals, they look at the charts and they talk to patients to find out if indeed their pain was managed. When patients are in long-term care facilities, the regulatory agencies that accredit long-term care facilities also look at pain as it's reflected by quality of life. And they feel that in order to have a good quality of life, you have to have your pain controlled. So it's also a criteria for long-term care facilities to make sure that their patients have their pain managed. And when their accrediting agencies come in, they look at their charts. They look to see what the patient's report is of pain. They look at the interventions that the nurses have done and if their pain was adequately managed.
Mm-hmm.
What is really important is the fact that it's not just the joint accreditation standards. It's not just Overlook's view on managing pain, but pain truly interferes with healing. If you're in pain, you can't move, you can't deep breathe, you can't cough. More patients are susceptible to pneumonia. More patients are less likely to move around and do physical therapy to improve their status. Pain is truly an important factor in their healing process, and people need to step up and say, I'm experiencing pain. Mm-hmm. I cannot walk down the hall because it's too painful. I cannot let you change my dressing because it hurts too much. Mm-hmm. Mm-hmm. It's truly a right to be free of pain.
Wow, that's wonderful for us to hear, and it's wonderful for you to hear that you as a patient or knowing a patient have a right to ask for pain management.
And that's really, I think, one of our major points. That's a key message that we have to let patients understand, that if they're going to a healthcare provider who tells them there's nothing more we can do about their pain, then they need to look for someone else who's going to address it. Because
wow, that's almost iconoclastic to hear.
Exactly. Nobody should be in pain. And people think that if they go to the doctor and the doctor says, you know, I'm sorry, there's nothing we can do, then they think there's nothing we can do. So part of our role is to empower patients to understand that it is their right, that there are things that can be done to alleviate their pain, and they need to be an active participant in figuring out how to do that.
Well, you know, I think a lot of patients, or most of us, have fears or worry about what would happen if we did get pain management or too much pain, or